Hi everyone. This video is about the abdominal muscles, and there are 4 of them. We have rectus abdominis, external oblique, internal oblique, and transverse abdominis. And they actually make a kind of muscular corset around our internal organs. How exciting. So let's go to our book. We are on page 209. Let's take a look at these, right? So the abdominal muscles, most people think of as being just sort of anterior and maybe anterolateral, but that's not entirely true. The abdominal muscles actually go all the way around. And this gives you an idea of how they do that. So rectus abdominis, external oblique, internal oblique, and then transverse abdominis. Like I said, they make a muscular girdle or muscular corset all the way around the abdomen. And this helps keep your viscera or your guts actually in place, okay? They help protect your viscera and keep them where they should be. A lovely thing to protect your viscera, your soft, squishy innards, basically. So we have these 4 muscles, and they actually go in 4 different directions. So we're going to have to talk about that. Most people know rectus abdominis, that's the one down the center, and it has those tendinous divisions here within the muscle itself. So if the muscle is well developed, you actually can see the divisions, and that is what is known as washboard abs. Okay. And you do have a couple of different structures in here that I want to talk about separately, but I guess the linea alba is really only on this page. It's only labeled on this page anyway. The linea alba is actually this piece of connective tissue that goes right down the center of your rectus abdominis muscle. So you have rectus abdominis on this side and rectus abdominis on this side, and in the middle is the linea alba. The linea alba actually contains your navel. So that's along that piece of connective tissue there. But the linea alba is a very distinct division between the 2 sides of rectus abdominis. Okay. You also have covering all of the rectus, even though on this side you can't see it, on this side you can. They're calling it the rectus sheath, but what it really is an abdominal aponeurosis. Okay. So you have a thoracolumbar aponeurosis on the posterior side. You have an abdominal aponeurosis on the anterior side. And this is a good picture of it. Just take a look. So let's look at it in the visible body, because I kind of like these better. So this is rectus abdominis. Of course, you can see that right there, rectus abdominis. But when we clicked off of that, before you could see this whole rectus sheath, right? And I don't know how to get it back, but that's okay. So rectus abdominis goes really from the xiphoid process all the way down to the pubic symphysis here. It runs straight up and down, hence the word rectus, and it's an abdominal muscle, so abdominis. This is a really good shot of the linea alba here. Okay. And if we take a look, it just tells you a little bit about how the linea alba developed and where it is. In the fetus, the umbilical cord passes through it, right? That's sort of why it's there. It was much larger at one point when you were in utero. And of course, the umbilical cord would have come straight into your person from your mom and of course, once you're born, that all closes up. And then the linea alba develops as sort of a remnant of that opening. Okay. All right, so we have rectus abdominis, then we have external oblique. External oblique, this is a very weird view. It doesn't quite cover, it doesn't cover rectus abdominis. Let's take that off. Okay, so this is a little bit better, and it's still weird, but here's what I want you to understand. This, all of this white part in here, all of that is the abdominal aponeurosis, and rectus abdominis sort of goes right into the abdominal aponeurosis. And the abdominal aponeurosis covers or partially covers the rectus abdominis. So that's why this looks the way that it does. So rectus abdominis is here, and it is covered by that abdominal aponeurosis. It doesn't quite look like this, though. You can see rectus abdominis, the fibers through the abdominal aponeurosis, but you get the idea. Internal oblique, that obviously is internal to the external oblique and rectus abdominis. So you can't see it from there. It's going to be deep, but it kind of goes all the way around as well. See? Like that. Okay. And then you have transverse abdominis. Transverse abdominis actually is what it says. It's a transverse muscle that goes all the way around to the back. Okay, and what it's not showing you here, I mean, it's showing you the spine, right? And its sort of relative position to the spine. But what it's not showing you is its attachment on the posterior, which is the thoracolumbar aponeurosis. So in that way, it actually makes a whole girdle all the way around. Let's go back. So I wanted you to see how these fit together here. So external oblique goes into or becomes part of the abdominal aponeurosis, which covers the rectus abdominis. Okay. Let's get to O's, I's, and A's here. So rectus abdominis originates on the pubic crest and the pubic symphysis, so all the way down here, and then inserts up at the xiphoid process and the cartilage. See right here, cartilage of the 5th, 6th, and 7th ribs. And the reason that that is the insertion and not the origin is because typically we flex our torso. We don't bring our legs up towards our face, although we can do both. And so in that sense, this is kind of like quadratus lumborum in that you have to just pick an origin and insertion because this muscle can act both ways. So what is this going to do? Well, obviously it's going to flex the vertebral column, right? It's on the anterior, so it's going to do anterior things like flexion. Now, if this muscle is tight, if it's hypertonic, it's going to pull on the pubic symphysis here, and it's going to pull the entire pelvis forward. And because of that, it can tilt the pelvis posteriorly. Remember that posterior tilt is when the ASIS goes backwards towards the posterior. And if you bring the pubis up, that's exactly what's going to happen to the entire pelvis. Okay. So rectus abdominis can produce a posterior pelvic tilt, but mostly it's a strong flexor. And that is what we do when we want to build up our abdominal muscles. When we want to strengthen them, we do flexion type exercises. External oblique. So external oblique is on the same plane as rectus abdominis as far as layers are concerned. So external oblique originates on the external surfaces of the 5th, all the way through the 12th rib. So this is all of the origin of external oblique. And right about here, up towards the upper part of the origin, the upper ribs, this actually becomes interwoven with serratus anterior. So serratus anterior would come down around the ribs like this, and it would meet external oblique there. Remember, serratus anterior looks like this as well, so it just kind of fills in the little gaps there. All right, so the origin is on the ribs here. The insertion, and this is a little weird looking, but you'll understand in a second, is the anterior part of the iliac crest here, but then the rectus sheath to the linea alba. So the abdominal aponeurosis to the linea alba. That's where everything connects, right? So that's why this line's just kind of hanging out there, because that's what that's supposed to represent. Now, actions. Well, these fibers go downward, okay, in a downward oblique. So these fibers kind of go like you're putting your hands in your pockets, okay? Hands in your pockets are external obliques. That's the fiber direction. So we do have some unilateral and some bilateral actions. Now, the bilateral actions are pretty much the same. It's going to be flexion, okay? Flexion of the vertebral column, absolutely. It's on the anterior, does anterior things. But also compresses the abdominal contents. You can engage your abdominals just sitting here. So as you're watching this video, you don't necessarily have to flex your vertebral column. You can just tighten your abs. And that compresses the abdominal contents. Okay. So if I just sit here and tighten my abs, I'm not necessarily flexing, but I am compressing everything. Okay. Now, the unilateral actions, we have lateral flexion. Okay. I mean, it is on the lateral side, so we can do that, lateral flexion. But this is a contralateral rotator. So we are going to rotate the vertebral column to the opposite side. External oblique is a contralateral rotator. All right. Next up is internal oblique. It's much smaller. Same kind of origin and insertion though. And these fibers run in the opposite direction. Okay, so external oblique fibers were like putting your hands into your pockets. Internal oblique fibers are crossing your hands across your chest. Okay, they go in the opposite direction as external oblique. So external oblique, hands in your pockets. Internal oblique, hands across the chest here. Okay, to remember the fiber directions. Now, the origin of internal oblique is the lateral inguinal ligament. Remember the inguinal ligament? Ah, memories. The iliac crest and the thoracolumbar fascia. See? So kind of the same place as external oblique, just a little more posterior, actually attaches to the thoracolumbar fascia as part of its origin. All right, then it inserts on the internal surface of the lower three ribs. So it's going to be internal surface of those three ribs. So actions. Oh, I forgot rectus sheath and to linea alba. That's actually part of all of them, by the way. The rectus sheath to the linea alba, because it's that whole abdominal aponeurosis, they all connect into it on the anterior side. And all but rectus abdominis kind of connect to the thoracolumbar aponeurosis on the posterior side, even though it didn't really look like external oblique does, because it inserts, or it attaches to the ribs. With the addition of internal oblique and transverse abdominis, they're all layered together. Okay, so the actions are almost the same as external oblique. We have flex the vertebral column and compress the abdominal contents for the bilateral actions. The unilateral actions include lateral flexion, but rotation is different. See that? Internal oblique rotates to the same side. Internal oblique is an ipsilateral rotator. Okay? So they're identical except for rotation. External oblique is a contralateral rotator. Internal oblique is an ipsilateral rotator. And it's because of the fiber directions. That's why I have you focus on them. It does make a difference. Now, last but not least, we have transverse abdominis. This one runs all the way around your abdomen. The origin is a little weird because of that, okay? You have the lateral inguinal ligament, okay, so we're down here again. You have the iliac crest and the thoracolumbar fascia. And you also have the internal surfaces of the lower 6 ribs. Okay, so we're starting all on the side here. And then we come around to the front and insert on the rectus sheath to the linea alba. Again, that's in all of them except for rectus abdominis. Okay, now, what does it do? Well, the only thing it can do is compress the abdominal contents. That's it. That's its job. Squish the guts. That's transverse abdominis. This one is the deepest. It is not palpable. The only thing you can do is kind of feel it by action. When you sit and maybe like take a deep breath out, or just sit here and try to compress your abdomen, that's transverse abdominis. Okay. And that's it. There is one more tiny muscle, maybe, if you have it. It is absent in roughly 20% of the population. So some of you will have it, maybe some of you don't. It doesn't matter. You can't feel it anyway. It's a little teeny tiny muscle called pyramidalis because it's in the shape of a pyramid. See that? And the only thing that that does is tighten the linea alba. It just tenses it. Again, I'm not really sure why it does that or what that function is for, or maybe was for, because this is not a muscle that I think we really use all that much anymore. You don't ever hear of anybody having issues with pyramidalis, that's for sure. Okay, that's it for the abdominal group. I will see you soon.